and welcome to EHI TV. I'm Shana Crispin and this is eHealth Insider's Essential News on Video. Today we're focusing on new information published by the NHS Information Centre on hospital mortality rates. That's the Summary Hospital Level Mortality Indicators, or SHMIs. With me to discuss the new data is Managing Editor of EHI, Lynn Whitfield. Welcome, Lynn. Firstly, the NHS had a way of measuring this before. Why the change?
Yes, it used to have something called the HSMR, the Hospital Standardised Mortality Ratio, and it's been publishing that information for a little while. Why the change? One of the things that came up when Mid Staffordshire was revealed to have some very high death rates and very poor care was that this indicator wasn't very well understood. And it made some changes to the way that it was measuring death rates, and that had quite a big impact on the problem that it thought it had, or in this case didn't have. And when the inquiries were held into what had gone wrong at Mid-Staffs, they decided that we could really do with a new indicator, and in particular that the indicator needed to have a look at what happened when people who were very near the end of their lives actually left hospital and died outside hospital, whether that should be included within the overall performance of how hospitals were doing. So there was a big working group, lots of important people got together, had a look at the methodology, and the SHMI, as it's popularly known, is the result of that.
Okay, so the SHMI has brought out it's made clear that there's 14 that are performing best and 14 that are performing worse. Are there any patterns in between these?
Well, actually, the NHS Information Centre's almost gone out of its way to try and avoid saying there are 14 trusts that are doing well and 14 trusts that are doing badly. What it's done is to publish some incredibly complicated looking Excel spreadsheets and some very complicated looking funnel patterns that, if you really know a lot about statistics, allow you to see who are the outliers. And they've even published 2 lots of these with different levels of sensitivity. So actually I think they tried quite hard to avoid the league tables, but obviously nasty journalists like myself just went, okay, who's good and who's bad then? Are there any patterns? It's very striking that those that have below level expected mortality or low figures on the SHMI do seem to be in London. Some of those hospitals I don't think would necessarily have done very well on some other measures, so that's quite interesting. It does also appear to be that quite a lot of the ones that haven't done so well are up in Yorkshire and the Humber, and so there's an interesting geographical variation there. I'm sure a lot of people will spend an awful lot of time over the next few weeks and months having a look to see why their hospitals have actually done well or badly, or whether there's any more underlying patterns to it than that.
Okay. Now it seems that the people that would benefit the most from this sort of information are the patients, but as you said, very complicated sets of data.
Yes, it's really disappointing to me, this, because the government has been saying, governments of all stripes have been saying for so long, we want patients, we want the public to know how the hospitals are doing so they can make informed choices about where they go into hospital, or they can just hold hospitals to account as taxpayers for how they're getting along. We've been publishing this sort of data for decades, and yet today this new mortality indicator comes out and it's hedged around with things saying, oh, it's not for the public and patients, it's for experts. Oh, I suppose if you really look carefully, you can work out how your trust is doing. And I just think this is very disappointing. If this is a good indicator, and it's supposed to have things to tell patients and the public, then I just think the Information Centre should have a bit more confidence and say, this is what we found. And if the trust then want to go and say, oh, well, our computer system was playing up, or oops, we miscoded loads of stuff, they can say that. And really, they ought to also sit down and say, do we actually have a problem? And if so, where is it? And, you know, that's the point, to improve care. I just think while people keep pussyfooting around going, it's all very difficult, it's all very hard, we're never going to have the impact that this information is supposed to deliver. So it'd be quite nice to, you know, this is a new era, we've got a new information centre effectively with the government's reforms coming in, we've got a new indicator. It would have been nice to have seen them being bold and just putting it on the maps. This is how your trust is doing, have a look at how other trusts are doing in their banding, pick out the outliers really easily.
Sure.
I don't know why they didn't.
Why? So you don't know why?
I suspect there's always a lot of politics around these things. You know, you've got a national body here that's collecting the information in a way that's quite controversial. They're obviously worried about upsetting trusts. I'm sure the government itself doesn't want a lot of trusts being identified as being problematic and difficult in the middle of its reforms. I'm sure that's why, you know, and you can understand those concerns, but at the end of the day, as I say, it would be nice to just have a bit more guts about getting out there and doing these things.
Okay, thanks, Lynn. Now, for more information on these indicators, EHI is currently featuring an interview with Tim Strawn, the Chief Executive of the NHS Information Centre. Strawn will also be speaking at EHI Live 2011, which is being held in less than 2 weeks at the NEC in Birmingham on the 7th and 8th of November.